I'm a ear, nose, and throat sleep medicine specialist in Houston, Texas. I treat primarily respiratory disorders. So when COVID came along, I was just welcomed people into my office. And I ended up becoming sort of a COVID treatment hub in my area. And I was sort of left to myself, but then I got called out by a hospital in Houston, and it kind of thrust me into the public. I was seen firsthand that these shots weren't working because I was doing testing and I was tracking people by their vaccination status. And I brought this to the attention of Houston Methodist Hospital, and they were the first hospital in the country to mandate the shots. They did it in April of 2021. And this was 5 months before Biden. So they really paved the way for the rest of the country. And I had privileges there. And they, when I brought this to their attention, that the shots weren't working, they glossed it over. And so I started speaking out on social media. And then they really viciously attacked me. And they turned me in the medical board. I am still fighting the medical board. So it's just been an unexpected journey.
And they tried to shut you down. You tweeted that this vaccine doesn't work. And then what happened?
Well, at the same time, I started speaking out about the shots not working. I spoke out against mandates. Then I was trying to help a patient who was trapped in a hospital. He had been on a ventilator for a month. Wife was suing the hospital because she wanted him to try ivermectin. The hospital had basically given up and they were talking hospice. Hospital would not let her do it. This is Texas Hughley Hospital. So she sued and then she asked me to help. Served as an expert witness and then as the prescribing doctor. Hospital turned me into the medical board the moment I became involved in this lawsuit. And so that, I had 2 hospitals turn me into the medical board. And, 4 years later, I am still fighting to clear my name.
I'm sure that you will be successful. But you also treated your patients with treatment, what was very successful. That means we had some cure from the start, but they banned it. What happened?
Yeah, initially I used hydroxychloroquine. And then when President Trump came out and started speaking about how great it was, Texas shut it down. Like we were not allowed to prescribe hydroxychloroquine off label. Like we could only prescribe it for lupus. So I kind of put that on the back burner. And then I started using monoclonal antibodies and those worked really well. They weren't controversial. I could get as many doses as I wanted and it was great. And then unfortunately the government shut down distribution. They took over the distribution and then they just shut it down. And this was in lockstep with mandating the COVID shots. So the same time that they mandated the shots, they took away monoclonal antibodies. And that's when I started using alternatives like ivermectin and hydroxychloroquine. And I was a little bit nervous about using them at first because monoclonal antibodies worked so well. I wasn't sure that, the ivermectin would do the trick. But what I found was that it did work. And I everybody that came to see me who got early treatment stayed out of the hospital. I ended up treating over 6,000 patients during the pandemic.
Your story is similar to other stories. And I also spoke with lots of doctors who had the same experience. What do you think? What was the reason? Why they shut down ivermectin when it was so cheap and so effective?
Well, I think it was very orchestrated. So, in March of 2021, the government was upset because people were not buying it. They were not getting these shots. They didn't trust this new product that hadn't been thoroughly tested. And at that time, only 10% of Americans had gotten the shots. So they knew part of the problem was that people were using ivermectin. And they thought, well, I have ivermectin, so why do I need this shot? So they came after ivermectin publicly. The FDA put out information on their website citing, okay, you should not take ivermectin for COVID. It was in the spring, and then in the summer, late summer, and this was during the third and the largest surge of the pandemic. They sent out a tweet of the attractive healthcare worker nuzzling the horse. It says, "Seriously, y'all, you're not a horse, you're not a cow. Stop it." And that was put out by the FDA, and it went viral, and it made it super difficult for me to prescribe ivermectin. It resulted in complaints to the medical boards for myself and other people all over the country. And so they did that very late August of 2021. And right after that, Biden mandated the shots. So I think it was all wrapped in with the mRNA shots that they had to get out there, and they were pushing on people. They had to take away ivermectin as an alternative to these shots.
As I know, they need to pull back this tweet, and now it's not there anymore. How this happened? They said ivermectin is not working, and finally, I think after some court cases or something else, they need to pull down. And we know now today that state was censoring, together with Twitter, censoring all doctors who were prescribing something similar.
Yeah, and we sued the FDA over what they did over ivermectin and actually won, and they had to take down their misinformation off the website. And in America, I don't know how it is in Croatia, but the FDA sort of regulates what is, what doctors can prescribe and what's over the counter. But 5 states, including Texas, have made it so that you can get ivermectin without a prescription. You still have to go through a pharmacist, so it's not technically over the counter, but it's slightly easier to get it now because you don't have to go to the doctor's office first to get a prescription. You can just show up at the pharmacy and buy it there.
Well, in Croatia, they're following gold standard of CDC. And when I saw their presentation of vaccines, they said, if CDC doesn't have anything against it, we don't see the reason why we should. And that's how they didn't mandate it vaccines, but they push it very hard, the same like everywhere in the world.